as part of its continued commitment to creating new sustainable health systems. The Future Proven Healthcare Index, that's the FPHI, has launched its newest white paper. It is described as a best practice document that focuses on solutions and policy actions to prepare African health systems for the future. Now, led by a panel of independent African health experts, this research outlines proposed policy recommendations and highlights important actors and key areas of focus. Now, one of these areas includes furthering gender equality through healthcare systems. The index shows differences across the continent in health status between men and women. Now, access to reproductive health care and family planning is lagging in many African countries, meaning young African women are often the most affected by limited healthcare systems. Professor Glenda Gray is the president and CEO of the South African Medical Research Council and part of the African Sustainability Index. She joins me on the news for more insight. Good to have you join us, Professor Gray.
Good afternoon, and good afternoon to your viewers.
So when we talk about gender inequality, people think education, people think early child marriage, people might also think, work-related issues, but never really the healthcare system. So talk to us about how the health system is also reinforcing gender inequality.
So in many ways, I think first and foremost, although we know lots of women are in the health sector, they very rarely are the leaders or in charge of the health ministry or our DGs. So we also have to put women first in these positions to make sure that they are part of the decision-making processes, because only when they are part of the decision-making processes are we able to make sure that women's issues are addressed. In terms of the gender issues, we also have to address issues around female literacy. So if we see a huge imbalance between the amount of education that girl children have compared to boy children, and this is a predictor of poverty and ill health. And so by looking at through a gender lens, we need to make sure we prevent teenage pregnancy, we increase access to contraception, we make sure that we address the in free healthcare for children, and make sure that we address that women need to be delivered, have their babies in healthcare settings, and have antenatal care. And women have lagged behind on this continent, and we have some of the highest rates of maternal mortality during childbirth, and still high rates of teenage pregnancy.
And it's interesting you mentioned teenage pregnancy because in this part of the world we do have different reactions to teenage pregnancy. For some parents who are loving enough to house teenagers who are pregnant, that's fine. But for some parents, the first thing is to kick them out. Talk to us about how much that is impacting on the maternal mortality rate.
So often, because the first thing about having a teenage pregnancy, you drop out of school, so you can't complete your high school. That's also a big predictor of adult poverty. In addition, young girls may not access antenatal care and hide their pregnancy, and so by the time they deliver, they have poor delivery outcomes. So it's very important, first and foremost, to try and prevent teenage pregnancies, and then where it is identified, to try and keep girls in school, because we know that if they fall out of school, they're going to be poor and impoverished for the rest of their life. And the next thing is to make sure that even if they are pregnant, they don't die during labor, and they don't have adverse pregnancy outcomes. Also issues around breastfeeding, as well as depression that may be associated with teenage pregnancy.
And I understand that the only way to resolve gender inequality when it comes to the healthcare system is to achieve universal health coverage. Now, is there a path for Africa in terms of transitioning into universal health coverage?
Yes, we have to drive universal health coverage, and by doing this we have to reorientate our health systems. We need to have closer regional collaboration across the continent and learn best practices. We need to reprioritize healthcare spending, also focus a little bit more on promotion and preventative health. We need to introduce technologies to improve our healthcare delivery, and we also have to address the issues of what keeps women out of the healthcare or poor access to it. So we all have to drive universal health coverage, and that does mean that we have to reorientate our health system to be more orientated to an efficient and high quality healthcare system in our countries.
But are some of these issues cultural? Is there any sort of awareness that needs to be done in terms of when it comes to families?
Yes, I mean, I think first and foremost, the best way to address poor health, particularly in women, is to make sure that girls get education. We can't be in a situation on our African continent where our young girls are deprived of secondary education, or that there are no plans made for them if they don't have high schooling in their village. We have to reprioritize how important the girl child is. The girl child is important for future generations, and the girl child is important to address poverty in families. A lot of our households are female-headed, and so if we don't empower women by making them healthy and by making them supported, is that we're never going to address a lot of the universal health coverages that we need. A lot of the health system and a lot of the health care at a community level is delivered by women. And so we need to make sure that, and women are caregivers. And so by addressing the issues of women, we can also address issues of care and promotion and preventative health in the community setting.
This conversation is one that needs to continue, just so women can have access to quality healthcare. Thank you so much for talking to us, Professor Glenda Gray, President and CEO, South African Medical Research Council.
Thank you.